Hello, this is Eric Christensen with Healthcare Compliance Pros. I want to thank everybody for attending to our presentation today on your compliance solution and avoiding the million-dollar mistake. We'll get into how that process can work and how HCP solves compliance for our clients as part of this presentation. Okay. Again, I want to make sure that you are asking questions during the process. So if I can answer them in line, if they're part of the information that I'm presenting at any particular time, don't hesitate to type your questions in the question window. Nicole Mark, our marketing associate, will be fielding those questions, and as they come up, I'll make sure to address them again if they are part of this, a part of the presentation, part of what we're working on at that time. Okay, we're going to start out with an introduction. We're going to introduce Healthcare Compliance Pros and me specifically, trying to make you understand what the compliance overhead is, an overview of just the compliance requirements. We'll also be showing you the HCP solution for compliance management and how HCP rolls that program out through next steps. Okay. Again, my name is Eric Christensen. I am the Director of Client Services at Healthcare Compliance Pros. I've been doing practice consulting, compliance management, speaking for more than 30 years in the practice management arena. I have been a practice administrator. I've been a director of information technology for healthcare. I have been a CIO and have been doing compliance consulting and IT consulting for practices, again, for more than 30 years. I also speak nationally on compliance, MGMA, and other national organizations, and presenting compliance solutions and compliance education for membership, again, all over the country. So when we understand, the compliance requirements, it really can become an overwhelming burden. Organizations all over the country are struggling to deal with more than 14,000 regulatory announcements that occur every year. In fact, in 2016, there were more than 14,000 regulatory announcements that could have affected your practice, your organization, or you as a consultant in what you're providing for your independent practices as well. Now, all of those regulatory announcements, all of those regulatory updates, mandates, clarifications, guidance, may or may not affect your individual practices and your individual organizations. But combing through and understanding how those affect your organization can be just an overwhelming process. In fact, we know from survey numbers that 74% of healthcare organizations say that they're not sure of the full scope of regulatory compliance as it applies to their practice, to their organization, whether they're a covered entity, a business associate, or involved in any other compliance regulations as it applies to healthcare. They just say that they don't know what their full scope of responsibilities are. So 87% as a result are reporting that they're not meeting a compliance requirement that they do know about, whether it be OIG exclusion list checking, security risk analysis, mitigating breaches correctly, that every potential release of information has to be investigated as if a breach did occur. The onus is on the practice to prove that a breach did not occur, or they must designate it as a reportable breach. And these breach costs can be just horrendous. The average breach is $5.5 million in overhead, whether it be fines, penalties, credit report monitoring, patient or reputation management. It can affect your practice dramatically. And we know that these breaches are occurring. Every 39 minutes a breach occurs here in the United States. So the numbers of breaches that are occurring I'm seeing even advertisement on, mainstream television about, find out if your information's on the dark web, and those kinds of scare tactics. So we want to make sure that you, as a healthcare organization, are showing due diligence to protect your patients, that your patients are educated on what you're doing to protect their information, and to protect your workforce and the organization as a whole. Well, because of all of that compliance requirement, because of the overhead and understanding and meeting those objectives, Healthcare Compliance Pros really has a different take. It's not about providing you with tools. It's not about providing you with worksheets and a figure it out as you go along process. Now, it does separate us from, other compliance management processes. A lot of them will provide worksheets or they'll provide training. But Healthcare Compliance Pros takes a completely different tact in that we become your compliance partner. We're managing your program for your organization. We're managing your HIPAA, your OSHA, your corporate compliance, and even HR through an assigned compliance specialist. That compliance specialist builds your program, creates and implements your policies and procedures, maintains your culture through ongoing assessments that are driven by Healthcare Compliance Pros rather than self-managed. As a former practice administrator, I know that you're juggling a lot of different balls. And making sure that you're wearing a compliance hat one day, or checking in patients, or dealing with employees and employee morale, all of those things can become overhead issues for you as a practice administrator. Healthcare Compliance Pros is about offloading that burden by taking that on and managing your program through your compliance advisor. Some of those things that really need to be addressed and that you need to look internally at your organization is, what are you doing with regards to policies and procedures? Do you have a platform for delivering those? Not just HIPAA training, but are you delivering your policies and procedures to your staff? HHS, OIG, and the Office of Civil Rights requirements for that delivery is that you train your staff on your policies and procedures. Not just what HIPAA is, but what HIPAA is within your organization. How are you dealing with your distribution of notice of privacy practices? How do you document for release of information? And do you have the support of a management team to answer questions on release of information for non-custodial parents, or for possible breach exposures and how those can be mitigated? HCP manages those on behalf of our clients. We meet all of the required and addressable standards on both your privacy and security requirements and policies. We provide a security risk analysis and follow that security risk analysis up with due diligence on mitigation and corrective action planning and maintenance. In fact, Healthcare Compliance Pros has been through more than 1,600 audits, investigative actions, both patient and disgruntled employee complaints, OCR audits. We've never had a fine or a fine handed down against an HCP client. And why is that? That's because we can show due diligence over time, a documentation trail maintained by HCP for our clients. Again, we're managing and tracking your business associates, all of your privacy and security walkthroughs. Your breach determination mitigation is all managed by Healthcare Compliance Pros as your partner. Not just tools, but providing you with a management of your platform. We're doing the same thing for OSHA. Did you know that the OSHA requirements for documentation and reporting changed in 2017? And does your program or does your vendor currently meet those new documentation and reporting requirements? We implement those changes and maintain that system for you. Our policies reflect those changes. And the training that we deliver to your employees, again, in your policies and procedures, as required by OSHA, are specific to your organization. Bloodborne pathogens, infection control, hazardous waste, all of those are developed specifically for your groups. Where is your eye wash station? Where are your sharps containers and hazardous waste receptacles? Even your egress routes and emergency evacuation procedures are all customized for each individual organization and each individual location of service within that organization. Again, managed and implemented by healthcare compliance pros. This isn't about creating additional work for you. This is about offloading the burden of compliance management. Within our corporate compliance environment, creating fraud, waste, and abuse programs, understanding and your relationship with your ancillary ownerships and your referral process. Do your employees and patients know about your ownership of any ancillary services? And how are you marketing and referring to those services for which you have ownership? Do you have a current fraud, waste, and abuse program? And are you educating your employees on lines of communications, their responsibilities as a whistleblower? Do you have your billing practices and your collection practices trained out to your employees? Again, when we build a compliance program, we're taking all of those pieces of information into consideration. We build those policies and procedures. We educate your employees on their responsibilities, and then we maintain them. As new CMS, HHS, or OIG mandates are released, we maintain your program. We notify you of any changes that result in additional overhead or burdens. But again, we're managing that process to make sure that your organization stays compliant. For all of our clients, we provide OIG exclusion list verification as part of our program. Not just your employees, but your business associates and vendors are automatically checked against the list of excluded individuals and entities on a monthly basis. Under our corporate compliance program, we also provide MIPS support if needed. We can talk about your workflows. We can talk about your quality measures and your scoring potentials on those. How we can pick up some of the low-hanging fruit under the MIPS quality payment programs to make sure that your organizations are scoring as well as possible and are avoiding a non-positive payment adjustment. Again, the government doesn't talk about it being a penalty. It's just a negative payment adjustment. But we want to make sure that you are protected as an organization and can be provided that through our MIPS solutions as well. And then we bring the process full circle. Healthcare compliance pros with our compliance programs make sure that everything works together collaboratively and cohesively, that your policies support each other across all of the elements of compliance. So, for example, your cell phone usage or social media policies don't violate HR standards and the Fair Labor Standards Act when you have a HIPAA policy in place. Making sure, again, that those are supporting each other rather than working against each other within your HR policies. Do your dress and appearance, tattoos and piercings policies violate potential bloodborne pathogen exposure issues? I had a group that had that their tattoos must be covered by sleeves on their shirts, whether they're wearing a nylon sleeve. They provided scrubs to their employees, and their employees were changing their scrubs every day. But the sleeves that employees were using to cover tattoos, those nylon elbow-length sleeves, were not actually being changed. The employees were required to provide those, and those sleeves were not being laundered on a regular basis. Well, is that potentially a bloodborne pathogen or infection control concern? So again, making sure that all of these programs work together cohesively, that your policies support each other, is the goal of healthcare compliance pros. Now, we manage this with our learning management system. Your compliance advisor manages that system provides you access to an entire course library that includes CME credits and the ability to create your own coursework. We have groups in our organization that have created courseworks on tasking, on MA orientation, new front desk orientation, information on maintenance on a piece of equipment. In fact, we had a dermatology group that had a $30,000 repair bill on a derm abrasion or hair removal laser for skin resurfacing and hair removal. We created a training on them on how to perform that maintenance cycle. They were using tap water rather than distilled water in the cooling system when they were performing their maintenance cycle. Now we have the employees training on how to perform the proper maintenance cycle on that piece of equipment. Now that information was provided by the equipment manufacturer, but we codified it or formalized it within our training program and rolled it out to their employees. We can even create external training links. So if you have trainings on other platforms, if your EMR or practice management software vendor provides you with training programs, we can link to those external programs, but still track them all within our learning management system, which means that you have one place to go for reporting and for tracking of completion of all of that training. Within our HR program, we're also tracking other compliance metrics. It can be document storage on disciplinary action and corrective action, customer compliments or employee reviews, all of your inoculations or testing, TB, Hep C, CPR certificates, DEA expirations, or licensure are all tracked within our employee documentation and tracked historically and for time periods for remote tracking by the supervisors or the employees themselves. So again, when we're building this program, we can show due diligence over time. In our wrongful termination suit, we provided information as a friend of the court on training and documentation that was held by healthcare compliance pros for and protecting that organization in that wrongful termination suit. Now that suit was ultimately dismissed based in part by the evidence that healthcare compliance pros provided as part of being that friend of the court. Now, we do that for all of our clients. All of that maintenance comes at no additional charge because, again, this is about maintaining your program, not just punching a button or having some tools. Again, this concept of avoiding the $1 million mistake is about due diligence. It is about willful neglect. It is about reasonable knowledge of those standards. And healthcare compliance pros, as I mentioned earlier, has never had a fine or a fine handed down against a client because of our management of the process. We're guaranteeing that those organizations stay compliant. Now, how do we do that? You have your HCP expert. They develop the program. They provide all of the compliance support for you and all of your employees at Healthcare Compliance Pros. We have our patented learning management system that delivers customized policies and procedures to each individual employee. We can show, again, that documentation of their sign-off and acceptance of those policies. We even provide the retrainings upon a corrective or disciplinary action with your employees. Your employees have access to all of the reference guides and manuals. This is a living and breathing compliance program that we can show is effectively delivered and updated real time within our program. All of the updates, all of the tracking, all of the reporting is done by healthcare compliance pros and managed by your compliance expert to make sure that your compliance cycle is always up to date. Okay? So when we deliver that program, when we build that program, we customize your program. We build your employee tracking. We build your reminders. We initiate your SRA and corrective action plans. We develop your SDS binder, develop your recovery planning. You know, CMS changed the requirements on disaster recovery planning in 2017. Our new emergency operations and disaster recovery planning meet those standards. And again, this is about a proactive program to meet ongoing corrective actions and ongoing guidance from CMS, OIG, and HHS. But really, it is about your specialist, building a relationship with your specialist on management of your program. So I'm going to switch over to our website really quickly. I haven't seen a single question come in as of yet. Let me switch over to our website. Okay? So at Healthcare Compliance Pros, we believe that this is about management of your program, stress not included. When you log into our system, you're taken to various areas depending on your role within HCP and your interaction with your compliance program. As a rank and file employee, you would come into what we call our employee dashboard. That employee dashboard lists out all of the training curriculum that has been developed specifically for your organization. All of your compliance trainings, any of your individual trainings as assigned by your compliance officer and managed by your compliance expert here at Healthcare Compliance Pros. You can take this training on any internet-connected device. All of our trainings are mobile optimized to allow you to train on whatever internet connected device you need or rolled out to your employees. You have the ability to interact or ask questions of your compliance advisor. So, for example, OSHA, CMS, HHS all require that you have the ability to ask questions as part of your interaction within your training. You must be able to ask for clarification. Our program allows for you to interact directly at a rank and file employee level with your compliance advisor. So you can submit questions during the training as part of this program. You also have direct access to our 1-800 number. You have access to your compliance advisor to ask any additional compliance questions if and when they occur. You also have access to all of the reference material. Now again, this is at a rank and file level. So you have access to all of the reference guides, all of the policy and procedure manuals. And remember, Healthcare Compliance Pros is doing all of the maintenance of this program for you. So your policies on active shooter, your policies on disaster recovery planning, or your OIG compliance plan are all maintained by HCP as part of our management of the program. All of the necessary forms are available down at that employee level. And you and your compliance advisor can manage these forms categories and delivery of these forms to you as an employee. Also, they have the ability to upload and maintain documents at an employee level. I-9s, W-4s, CPR certificates, immunization documentation can all be maintained here within this program. Each individual employee has access to an SDS binder maintained by Healthcare Compliance Pros with version and date stamping, again, as part of our management of the process. Okay? This is about managing your compliance program. Our administrative dashboard tracks all of the metrics to make sure that your program is compliant and maintained. Your business associate agreements, vendor contracting, all of your exclusions or your breach mitigation are all maintained within the HCP system, and all of the work is done by HCP to make sure that mitigation or due diligence is tracked. Your safety data sheets, your vendor contracting, all of your agreements and all of the requirements are held here within HCP. We break your organization out into specific organizational subgroups. So we can talk about a location, a department, a supervisory group. We can create basic training requirements based on your role or your organizational structure. We can also track all of the trainings and all of the employee tasking. So for example, we're tracking TB testing, Hep C, CPR certificates, OSHA inspections that have been assigned to be conducted by that. We did have a question came in that we'll be sending out a portion of this slide deck. The slide deck will be released and is available to anybody who attends this webinar. So don't worry about recording this. The slide deck will be made available to you. All of the documents, all of their due diligence over time, again, is maintained by healthcare compliance pros down even to an employee level. All of the assessments, your security risk analysis, your walkthroughs and assessments are all tracked historically over time, are part of an HCP management process. This is HCP managing this process and showing completed mitigation. Again, that's why we've never failed a meaningful use audit with regards to our SRA process. In fact, SRA was failed in more than 67% of meaningful use audits that resulted in a repayment or a non-payment of meaningful use dollars. It's never happened to an HCP client because, again, we can show that due diligence over time. That's kind of an overview of the program. That's kind of an overview of how we're managing the process. But our coursework really gives you the ability to leverage out our library. Okay? Credit card security awareness training, active shooter. I don't even like to mention that, but it just seems like there isn't a week that goes by where we don't have an incident where something's happening with that. We want to make sure that we're protecting you and protecting your organization by being proactive in our compliance and trainings that are delivered to your employees and to your organization. So Healthcare Compliance Pros builds the program, maintains the program, and really is the compliance partner for you and for compliance management over time within the HCP process. Okay? So as we move back, I do have some general questions that would be great to get in as part of this process. So one of the questions that just came in is, does it allow me to make a decision whether I have a breach, and does the HCP make that decision and send the results, or do we do it yourself? We actually work the mitigation process for you. We don't actually do the HHS reporting. We collect the data. We make a determination on whether a breach did or did not occur. We go through the 4-step process that's required of any potential breach. We document that, and then we get that information over to you for reporting. But you're ultimately responsible for reporting to HHS. We work the breach process through, as well as set up any mitigation plans. So for example, if you have to do patient notifications, if you have to do a release and a posting on a website, all of that would be part of a mitigation plan we would put together for you and for your group. Okay? Any other questions that have come in? Nicole.
So some of the common ones that we do here over here are just people want to know, how do I get answers to my compliance questions, and what training does my staff need to meet compliance?
So that again is part of this where we're managing the process. So you have your compliance advisor. How you're getting answers to your compliance questions is you're submitting them directly to your compliance advisor. Your compliance advisor has a full legal and R&D department that does research on compliance questions at no additional charge. That research and legal department is also who handles breach determination, investigation, and mitigation. As far as what trainings are required by your staff, again, that core curriculum is assigned by your compliance advisor to meet the requirements for your specific location. When we do an intake with your group, we're looking at your organization as a whole. We survey your organization and establish those compliance parameters. You know, business associate determination is also part of our offering to you. So we're going to work through a business determination matrix with you, helping you define who creates, stores, maintains, or transmits PHI on your behalf. It's the definition of a business associate. So by that example, is a janitorial service a business associate? No. Is a plumber? No. They may have inadvertent contact with PHI, but that is not something where you've tasked them with handling and managing that information for you. Okay? So, our safety data sheet program is also available offline. So we have some groups where the OSHA inspectors want to come in and see that safety data sheet binder. We've gone through multiple OSHA inspections with our safety data sheet and inspection process. We've never had an OSHA failure as a result of an HCP managed clients. Okay? So, these are the kind of questions that we answer for our clients. It's about managing the program, becoming that resource, becoming, the heavy lifting behind your compliance program. We're not going to be your compliance officer in name, but we're definitely going to be providing all the support to you and to your organization for you and for your compliance program. Okay? Let me get back to Healthcare Compliance Pros is onboarded and built. So I had a question come in, do we do MIPS for our clients? Well, there's two different levels of MIPS and what is required under the MIPS program. There's the actual quality reporting, which can be done through a clinical data registry, through your EMR program, through the website. There are several different reporting mechanisms. We do not do the reporting on the MIPS program. We're not going to submit the reporting or the quality standards. What we are helping to do with is establish the workflows and the quality measures that your organization can be expected to meet. In 2017, to avoid a negative payment adjustment, again, I'm not saying a penalty because they don't say penalty. A negative payment adjustment is to make sure that you're meeting the ACI model and that you're reporting on at least one quality measure for one patient. That standard was also adopted as part of a Pick Your Own Pace for 2018. So as we move through the programs, we're going to make sure that you're avoiding that negative payment adjustment, even if it's through an attestation process through the website. If you choose to do quality reporting, we will help you determine what your best quality reporting mechanism is, whether it be an EMR, whether it be a clinical data registry, or whether it be a web portal, and we'll help to implement that process, but we won't be doing the reporting directly. Okay? So that's a question that came in with regards to our MIPS process. Now, with more than 6,000 offices in 47 states that are using our program every day, we've truly refined the process. In fact, I need about 3 to 4 hours of you and other stakeholders within your organization. I need their time to build and implement and roll out your program. So in that 3 to 4 hours of effort on your part and other employees within your organization, we, through your compliance advisor, build your employee and their employee accounts. We implement your program, build out your policy manuals. We assign the trainings and roll out our program in this HCP process to make sure that we're offloading the burden. And again, once we've done an intake and policy development for your specific group, it is HCP's responsibility to make sure that the policy updates are applied, that training is managed and performed by your employees. What I like to say is about the only thing I can't do is I can't walk down the hall, put a hand on Becky's shoulder and say, Becky, I really need you to get your training done. But I can advise Becky that her training is out of compliance. I can advise Becky's supervisor and ultimately the administrator of Becky's account that Becky has not completed her training. Again, I'm offering CME credits as a carrot rather than just a stick to some of your physicians. I'm making sure that your organization is protected. One of the other things that we get a tremendous amount of, do my physicians need to take this training? Do my physicians need to participate in this program? And your organization is a corporation that it needs to protect itself, just like the hospital or the health system or the ambulatory surgical center that your physician has privileges to, protects themselves. They're looking to make sure that the training is completed, that the documentation trail is completed for any provider who has privileges within their facility. You need to look at your own corporation, your own practice and organization as that same entity. You're protecting yourself. Your physicians need to show due diligence within your corporate environment. You need to protect and indemnify your practice, not just protecting and indemnifying that organization. Okay? So that's kind of the overview of our program. That's how the HCP process works. I've had some questions that have come in. I want to make sure that any questions that you have get addressed. If you have any additional questions that you didn't want to post online, don't hesitate to reach out to me. I answer all of my email at eric@hcp.md, or you can reach me at 855-427-0427. I'll be happy to answer your questions, client or not. This is about providing service to our prospects, our clients, and anybody out there in the healthcare community. Again, I speak nationally on these subjects. I provide education sessions at conferences all over the country. I'm perfectly willing to support your organization. Don't hesitate to reach out to me. Before we get off, Nicole, were there any other questions that came in that I didn't address?
I did have one more that came in, and it was just in relation to emergency preparedness. And they just want to know, do you help with the emergency preparedness plan that we are required to implement?
Yes. Again, you know, under a different name, the disaster recovery planning, emergency operations planning, emergency action plan, all of those things are part of what Healthcare Compliance Pros has implemented. Now, again, that was a new mandate for 2017. Did we charge our clients more money that were already participating in our HIPAA programs for that? No. We implemented that mandate. We reached out to do corrective action as part of our management of the program. That's part of HCP and their proactive program of managing your compliance. And this proactive management is really where we talk about avoiding the million-dollar mistake. This is not willful neglect. It is not reasonable knowledge or lack thereof. This is about HCP making sure that you're protecting your organization. And that's about what Healthcare Compliance Pros is and will always be about, is managing the compliance programs of our clients. This isn't about tools. This isn't about a bunch of spreadsheets. This isn't about a bunch of PDFs that you can download and put your name at the top of. This is about us building your program and then maintaining it for you, really offloading compliance and becoming that compliance partner that you need to let you get back to what you need to do, which is managing your practice. Okay? Thank you. And this recording and a copy of the slideshow and the presentation will be made available to all of our participants. Okay? So again, don't hesitate to reach out to me if I can help you. Otherwise, thank you for your time. And again, just be happy to be out there and talk to you about what we could be doing for you at Healthcare Compliance Pros. Thank you.